This is Nakafiro Sarah, and you would call her Sarah. And I think this is the most beautiful smile in the world. When we first met her in Kampala, Uganda, her husband had been missing for 2 years, lost in the war in southern Sudan. She was about to be evicted from her small plot of land. She has 9 children, and selling tomatoes and onions wasn't enough to support her life. As a result, she was severely depressed. The team at Strongminds invited her to one of our therapy groups. The change in her life was rapid. The therapy group members helped her to negotiate with her landlord so she wasn't evicted. The group members, now her friends, gave her the courage and the strategies to seek out a long-lost relative who helped to grow her business and raise her income. Today, Sarah is better, stronger, independent, and no longer depressed. Her kids are happier, healthier, and back in school. When Sarah's husband finally returned, sadly completely blind, she was able to take care of him. And she also wants to give back. She wants to help other depressed women who are also depressed like she once was. With Strongminds' help and supervision and training, she's now running her own depression group to help her peers remain depression-free. Sarah overcame her mental illness of depression, and she knows how to prevent future depressive episodes. She's a success story for Strongminds, and we want to help more people like her in Uganda and Africa. There is an epidemic, a silent epidemic that most of you in this room have probably never heard about, that is destroying the lives of millions in Africa. Depression in Africa is marked by the most severe stigma, where the ignorance of friends and relatives can lead to a sufferer's expulsion from their family, and where sufferers of this disease really have as their only source of treatment local healers, witch doctors. Let me help you to learn more about depression in Africa, but first, let's make sure that we understand what depression is anywhere in the world. Depression is not sadness. Sadness is a cold, and depression is cancer. Depressive sufferers experience debilitating symptoms. They have low levels of concentration. They can't complete most normal tasks. They have low degrees of fatigue, reduced appetite. In Africa, and particularly in Uganda, we have 60 million women who suffer from depression. In eastern Uganda, where we're asking for your help, 35% of the women experience levels of depression. That's 4 to 5 times higher than the rate here in the US. Now, depression is the #1 mental illness in the world and in Africa, but what you probably didn't realize is that depression is the #1 disabler of women in Africa. When an African mom is disabled by depression, her entire family suffers. What's even worse is that there is a critical shortage of mental health professionals in Africa. Uganda has 40 million people. There are just 30 psychiatrists in that country. Think of that. Here in San Francisco, you have just under 1 million people, yet you have about 400 psychiatrists. The Ugandan Ministry of Health, or Department of Health as you would call it, spends just 1% of its budget on all mental illnesses. And foreign aid doesn't help. Of all external health aid given to Africa over the last decade, just 0.7% was allotted for mental illnesses. Mental health is not on the radar for Africa. So the situation sounds dire, but it's not entirely. There is an opportunity here. My team at Strongminds is working to develop a scalable solution to treat depression in Africa. We are the only organization focused, or singularly focused, on attacking this epidemic. We exist to improve the mental health of impoverished, depressed women in Uganda using a simple, cost-effective, and proven model of group talk therapy. And we focus on depression because it's the #1 illness, and that's where we can make the biggest difference. In Uganda, in the last 2 years, we have treated over 2,000 women using 12 weeks of group talk therapy. And more than 90% of these women were depression-free at the end of the therapy. And by depression-free, I mean that they were no longer able to be diagnosed with depression. Their symptoms had become that low. Women in this therapy are able to identify their triggers of depression. They work together in a group to come up with strategies based on their life experiences. And as part of a group, they are able to form a strong social network with their other group members. So most of these groups continue to meet over the long term after formal sessions end. So they have a strong social support network that allows them to meet over the long term, and they can rely on one another to prevent future depressive episodes. But to really attack the depression epidemic, Strongminds is working to develop very simple talk therapy groups that go viral and are led by African women who graduate from our original talk therapy groups. At the end of the day, we can't solve the epidemic by having Strongminds operate therapy groups for the next 20 years. It's about African women operating their own therapy groups. We're teaching these women to fish. And I'd like you to meet some of these women now in our film.
My husband died. I was alone. I was jobless. I was feeling so bad. I felt like somebody who is useless. I wanted even to kill myself.
I fell sick. Then they told me that I had cancer. That's where the depression came from. I had no one to talk to. I had no friend. I was just there.
I've come to Strongman just because I have what they call depression.
One of the key ingredients that is helping Strongminds Group solve depression is because we bring these women together. They have solutions to their own problems. So when they give these suggestions, we find that their levels of depression is able to go down.
I learned that I was not alone. It was not the end of the world. Still life can go on. You had to live.
When I share, then I'm feeling okay. I know I will be better.
Since this group started, I became a very strong woman.
The Strongminds changed my life. I have hope.
I'm happy. I'm happy now.
Strongminds, oh yeah, Strongminds, oh yeah.
We're learning that when women become depression-free, their entire lives improve. They go back to work, their incomes increase, their kids go back to school, their entire families get physically healthier. And here at the Battery, you have the opportunity to help us to expand our impact. We're asking for your support to expand into rural eastern Uganda, where we can reach 5,000 more impoverished, depressed women. And we can help them to become depression-free, the same way that we helped women in this film like Christine, Angela, Prosy. And we can also help their 20,000 family members and return them to productive and satisfying lives. And we can do that at a cost of $53 per patient treated. $53, our costs are incredibly low. We don't build clinics. We work with our patients in the communities where they're located. We work on their doorsteps. We literally work under the trees with the patients. Why is now the time to do this? Because, as I mentioned, we have the simple model that's cost-effective and proven. There are there are millions of women and family members who need our help. I started Strongminds because I've lived and worked in Africa for over a decade, and I've seen up close and personal the debilitating effect of mental illness and depression on women like Sarah. Strongminds has the vision, the goal of treating 2 million depressed women by 2025. We have to scale our impact now, and I'm asking you to help us take that next step. My name is Sean Mayberry, and my team helps to build Strongminds. Thank you. Yeah. Any questions, please? Yes, sir.
Can you just talk a little more about your local recruitment process and training of your local group leaders and facilitators, that kind of stuff?
Sure,
A little bit
sure.
how that works?
Sure. So I call it group talk therapy. Officially, it's group interpersonal psychotherapy. And we're advised by Dr. Myrna Weissman and Dr. Leonard Verdelli from Columbia University. And we actually use lay facilitators. So the people on our team are not mental health professionals. These are people who have at least a high school diploma in Uganda. They're trained by other facilitators who have been trained by people in the States, but this is entirely a program that is Ugandan to Ugandan, so we are not bringing in foreign trainers from the US or anything like that. Officially, for group interpersonal psychotherapy, it's a 2-week classroom training, and then it's a 1-year on-the-job training where the people are actually, our employees are actually conducting groups under close supervision by other Ugandans who have already been certified in group interpersonal psychotherapy. Today, for example, we have 15 group leaders, each of whom conduct 2 groups a day, 5 days a week. So for example, one group leader will actually reach 300 depressed women per year. Sure. Yes, ma'am.
What brought you to Africa 10 years ago?
All over the place. 10 years ago, I was a foreign service officer working at the embassy in Nairobi and left that just before it was bombed by Al-Qaeda. And then I went back in development work building malaria distribution nets in the middle of the Congolese War. Yeah, sure. But throughout all that, I just saw the impact of mental illness on Africans and the fact that there was no access for them. What I didn't mention, because of the lack of investment, 1% of the Ugandan Ministry of Health budget, for example, 85% of Africans have no access to mental health care. So if you're a Ugandan with depression or schizophrenia or any mental illness, you simply have no access to mental health care. You go through your mental illness just repeatedly. You have no access for treatment. So that is what we're trying to do, and we're focused on depression and providing that access because it's the #1 mental illness. That's where we feel we can make the biggest difference. Yes, ma'am.
I'm curious how you measure, how do you evaluate success? How do you evaluate success? Going through a 12-week training program or a 10-week program doesn't necessarily mean the woman is depression-free at the end. Depression is an ongoing.
No, you're absolutely right. And we measure that in different ways. So we use a diagnostic tool called the Patient Health Questionnaire 9, which is really measuring the 9 symptoms of depression. We measure that at the end of the group and then repeatedly every 6 months for our patients to understand how well are the patients doing over the long term, because it's both the immediate reduction in depression and then over the long term. Because yes, if we just measured initially after the group, that would be not the right measurement basis. It's about both the immediate impact and the long-term impact. So.
But it's also self-reported. Is that correct? I mean, that's how you.
Yeah, exactly. I mean, right now it's a self-reporting tool, which is generally what's going on in terms of how you measure depression. I mean, we are looking at ways that we can do kind of third-party evaluations in terms of interviewing family members and friends, and that would be kind of an ongoing and an improvement process for us to look into. So I'm told that we're done. Thank you.